It was the perfect storm for a very frustrating, very excruciating breastfeeding experience. I would cry every single time we would be nursing. They were telling me that I needed to be nursing every 2 to 3 hours. Then I found the Thompson Method and I was like, wow, I think I have been doing really everything wrong.
In a world obsessed with convenience and quick fixes, I'm approaching wellness differently. After healing from chronic illness by overhauling my entire life, I'm now on a mission to help women like me to thrive and not just survive. I'm Kristen, and you're listening to the OrganiMama Podcast. Here's a quick game for you. Read the ingredients on your protein powder. If it sounds like a chemistry exam, that's a red flag. Gums, fillers, artificial flavors, and stuff you can't pronounce, all for protein? Equip protein powder keeps it simple. No fillers, no gums, no junk, and flavors that are fully disclosed. It's grass-fed beef protein that's easy to digest and gentle on your gut. If protein powders usually leave you bloated, uncomfortable, or questioning your life choices, head to the show notes, click the link, and switch to Equip. My code KVG gets new customers 15% off.
Welcome back to the OrganiMama Podcast. I am here for a solo episode today to talk to you about all of the things I know about breastfeeding and weaning. This is actually one of the most common topics I get asked about in my DMs on Instagram. So I figured it might be worth just sitting down for a little bit to share all the things that I've learned over the course of 2 kids, and any and all advice that I have or thoughts I have regarding more like a holistic approach to breastfeeding and weaning. So the first thing that I will say is successful breastfeeding starts with preparation during your pregnancy. And I definitely did not do a good job of this before my first baby. I had the kind of idea in my head that breastfeeding is natural and I should be able to instinctually know how to do it. And so when I got to the point of birthing my daughter, I figured, I'm just going to be able to figure it out. It's going to go great. I'll just do some trial and error to see what works well for me, and I'm sure it'll be great. Spoiler alert, it was not great and it did not go well. And within a few days of having her, I really wanted to, give up because of how difficult things were. And I really just I was not prepared whatsoever for breastfeeding. And while it is true that this is a natural function that our bodies are designed to do, unfortunately, we live in a fallen world and our babies come out with all kinds of tension. And a lot of times they've got midline issues. They might have MTHFR. They might have a tongue tie. They might have, any number of factors that could be contributing to breastfeeding being difficult. And so, just to say, I bet it'll just work out fine because it's instinctual. Well, it might not. And unfortunately, with the Western culture right now, there really is a lot of this mindset of like, well, if breastfeeding is challenging or if it's an inconvenience to you, then it's no problem to just transition your baby to formula and do what you need to do so that it's, not weighing on you mentally or physically. And I have a lot of thoughts on this topic. I think that, first of all, formula companies have very unethical ways of promoting their products. Like, there's nobody that can make money off of breastfeeding being successful for mothers. Nobody makes money by you breastfeeding your baby, but formula companies make millions of dollars by convincing you that formula is easier or better for your mental health than breastfeeding. So of course it makes sense that formula companies are going to dog on breastfeeding either very outwardly or in more subtle ways to make you think, well, if breastfeeding just doesn't work out for me, or if maybe it's just too hard, or if it's too painful, or if it's just like causing my postpartum depression to be worse, then maybe I'll just switch to formula and it'll be fine. And that's what those companies want you to think. I wholeheartedly disagree with that. I think that the number of women who turn to formula, it breaks my heart because obviously I don't think this is a hot take. I think this is a biblical take that breast is best. Historically, formula didn't exist. So if babies weren't breastfed, they would die. or they would have to have a wet nurse. So like another breastfeeding mother who would feed them from the breast. And, formula didn't used to be an option. And now we've pretty much normalized that formula is an option for women who can't or don't want to breastfeed. And I do think that because of the existence of formula, we work a lot less hard to make breastfeeding work for moms and babies. And unfortunately, the support is just not often there. Like hospitals have lactation consultants, and they're going to send in somebody probably if you say, hey, I want to breastfeed my baby, they're probably going to send in a lactation consultant to chat with you or take a look at you. But there's no guarantee that lactation consultant has even been trained in a way that promotes breastfeeding that can last for your child's entirety of infancy and beyond. You don't know what kind of credentials they have, even if they're an IBCLC, which is like the International Board Certified Lactation Consultant. You don't know what kind of training they've been through. You don't know what avenues they've been through to get that training or certification. You don't know what methodology they've been trained in. And honestly, there is a lot of stuff that is promoted by hospital IBCLCs that I think is completely wrong. I'm not a lactation consultant, but I am a breastfeeding mom who has had 2 kids that I've breastfed up to a year and a half. And I've taken a lot of time to learn these things. And I've also spoken with quite a few experts on this topic. And I think that hospital IBCLCs are rarely the person that you actually want teaching you how to breastfeed, or nurses. Baby nurses, baby mama nurses who are in the hospital that are coming in and trying to help you nurse. That might be well-intentioned, and maybe they personally have breastfed kids before if they're moms. And sometimes, sure, they might have helpful advice for you, but they also might steer you in the wrong direction and make things worse. So let's break this down and talk about it just a little bit. For those of you who are either pregnant or you're dealing with breastfeeding issues, let's dive in and talk through all the things that I've learned over the course of breastfeeding both of my children. Now, I would say one of the best things you can do to promote a potentially successful breastfeeding relationship between you and your baby is to prepare yourself for breastfeeding during pregnancy. Now, there are a lot of good ways to learn about breastfeeding and train for breastfeeding, prepare yourself for breastfeeding. But personally, there is one breastfeeding course out there that is so unique and so different from all the rest. And I have seen the most success from this one because of how they do it differently. It is called the Thompson Method. This is the method that I have heavily relied on for both of my babies. And when I say they're unique, I mean that. So the Thompson Method is a way of handling breastfeeding that is kind of countercultural to what you're going to be learning from hospital IBCLCs or nurses and things like that. Because what you're so often told when you're in the hospital with your new baby, or maybe this is even a home birth and your midwife is trying to tell you trying to help you with breastfeeding. What you're so often told is that you want to point the baby's nose toward your nipple, and then you want to wait until they open with a wide mouth, and then you want to shove your breast into their mouth, and then you want to make sure that they have a quote-unquote deep latch. And then what's most often taught is the cross-cradle hold, which is where you are holding the baby in your arm, but you also have your other hand on the back of their head. And you actually may not be supporting any of their weight in your arm. You may be mostly holding them up by the back of their head. And you may be told to take the hand of the side you're nursing off of to squeeze or pinch your breast into the quote unquote hamburger hold to kind of make it easier for your baby to latch on. I think that all of this is complete BS. And I realize there's going to be people who disagree with me, but hear me out on this, okay? So the Thompson Method was started by this Australian midwife who practiced in both hospital and home birth midwifery care for multiple decades. This lady had a ton of experience. And one of the most common threads she saw among women giving birth was pain with breastfeeding. So this midwife goes on to get her doctorate, a PhD in nipple trauma. She is the only one in the entire world with a PhD in this topic. So she performed multiple studies over the course of getting her PhD in nipple trauma, where she was looking at what are the common denominators between women who experience nipple pain with breastfeeding. And the common denominator that she found over and over and over and over again was that mothers who were taught postpartum to do the cross cradle hold, where they were holding onto the back of baby's head with their opposite hand, was linked to nipple trauma. And so this was the basis for all of her research. And she went on to create this incredible breastfeeding course called the Thompson Method, where she teaches mothers how to wash away this standard of breastfeeding care, which is the hamburger hold, the nose to nipple, the waiting for them to open wide and then shove on for a deep latch and hold on to the back of their head. She does away with all of this and says, none of that is natural. None of that is instinctual. And none of that is what your baby is wanting from a feeding experience. So this is why we're getting all of this nipple trauma, is these babies are chomping on the nipple because the nipple is landing in the wrong part of baby's palate inside their mouth. And so what she says is the right way to do things is to do the regular cradle hold, which is whichever breast you're feeding off of, you're going to place baby's head on your forearm of that same side. Your opposite hand is going to gently be supporting their backside, like their bottom area. It's not going to go on the back of their head. So the back of their head and neck should not be touched by your hand at all. And you're not going to pinch your boob. You're not going to smash it into a hamburger shape. You're not even going to wait for them to open for a wide mouth to get a deep latch. Actually, what you're going to do is position baby's mouth directly over your nipple. You're not doing nipple to nose. You're just positioning baby's mouth directly over your nipple. You're going to let them latch at their own pace when they want. Yes, it might hurt for the first 15 seconds, but then what you're going to do is these fine-tuning adjustments with your body and your arm to turn baby so that both of their cheeks, their chin, and the tip of their nose are all evenly pressed into your breast tissue, because it's this tipping of babies, and they can have this tightness to them after birth. They're tipping either towards your hips or towards your chest, or they're leaning forward, and it's causing your nipple to be suctioned into their mouth at the wrong angle, and it's causing nipple trauma. So this is very unique information, because you're not going to be told this by basically any lactation consultant in a United States hospital or any nurse. This is very unique, but this lady literally has her PhD in nipple trauma, so I would tend to trust that. And she's a midwife with tons and tons of experience. So what happened to me is when I had my daughter in the hospital, I had not done any preparation for breastfeeding, and within the first 2 hours of nursing her, it was starting to hurt a lot. And we had the IBCLC who came in, and she was making all these suggestions about the cross cradle hold, putting my hand on the back of baby's head. I didn't know any better, so we started trying it that way, doing the hamburger, pinching the boob and then smashing the baby's face on as soon as they open wide. And boy, oh boy, was it so frustrating. And then the other thing that happened was within about 48 hours of birth, I had this crazy amount of engorgement. And oh my gosh, it hurt so bad. My boobs grew 4 cup sizes, and they were so engorged, so painful. And I ended up having pretty bad oversupply and overactive letdown. So between painful nursing, oversupply, overactive letdown, and then we come to find out that our daughter has a tongue tie, it was the perfect storm for a very frustrating, very excruciating breastfeeding experience for the first 10 days or so. And I would cry every single time we would be nursing. And the other thing too is that they were telling me that I needed to be nursing every 2 to 3 hours around the clock. And so it seemed like my daughter was just really hungry. And so we started nurse. I was doing pretty much every 2 hours. So I was feeding her about 12 times a day. So then I found the Thompson Method. I think it was a late night Googling session where I'm just Googling how to figure out how to stop nipple pain, breastfeeding sucks. Where do I turn? What do I go? Where do I go? And I saw an advertisement for the Thompson Method, and I looked it up, and I saw something about this midwife who had her PhD in nipple trauma. And I was like, well, maybe I could learn something from her. So I promptly bought the course. I watched almost the entire postpartum section of it within one day. And I was like, wow, I think I have been doing really everything wrong. And then what I did is actually scheduled a rescue session with their team. And you basically have a Skype call where you get on and you do a nursing session with your baby. They observe you, they help you troubleshoot, they talk with you through on a personal level, like bio-individual level. They help you think through what your problems are and how to resolve them. They'll actually demonstrate better breastfeeding techniques to you on this call. I ended up doing this breastfeeding rescue call with both of my babies because it helped me so much the first time that I actually went ahead and did it again the second time with my son. And oh my gosh, it was like a night and day difference. Once I started implementing the techniques that I had learned in the Thompson Method, and I'm going to pause right here and just say, I obviously just explained a little bit of it, explained a little of the techniques here. Don't just try to do what I've just explained here. Like, you really need to go buy the course and watch it for yourself because there's a lot of context I'm leaving out, a lot of other parts of it that I didn't mention. So I think maybe some of what I just said could be helpful for you in the meantime, but I really don't recommend just being like, oh, Kristen said the Thompson Method said this, so go do this. Go take the Thompson Method course for yourself and listen to them explain it because it's going to be a way better explanation than I could ever do on this podcast episode.
Hot take, if you're focusing on clean food but ignoring your air, you're missing a huge piece. Indoor air can be up to 100 times more polluted than outdoor air, and after losing our first home to mold, I don't mess around with that anymore. Air Doctor is our go-to purifier brand. It's super quiet, low EMF, and filters mold, dust, pollen, pet dander, smoke, VOCs, plus 99.97% of flu and COVID viruses. Do yourself a favor, check out the show notes, and get up to $300 off Air Doctor. Your lungs will be very grateful.
So anyways, I had a breastfeeding rescue call with one of their lactation consultants, and most of them are based out of Australia, and it's kind of awesome because you get on and you're like talking with someone who has like a super thick Australian accent. And you're like, I just feel so cool, like being instructed on breastfeeding by someone in Australia. So that was really cool. But it was literally like a night and day difference. And I got to chat with them about my daughter's tongue tie, and we debated on whether or not we wanted to revise it. But ultimately, the Thompson Method, they are very strong on the mindset that tongue ties more often than not don't need to be resolved or don't need to be cut in babies, and that there are micro adjustments you can make to your actual breastfeeding technique that will make breastfeeding much more successful without the need to revise a tongue tie. I have more thoughts on that. We'll probably have a tongue tie expert come and speak on the podcast at some point, but we ended up not revising my daughter's tongue tie. We will revise it actually in later childhood. But in infancy, we decided that it was not worth it to do the revision. But we did end up putting her in myofascial therapy to help with body work, and we took her weekly to the chiropractor. And both of those things I would say are super imperative if you have a baby who's tight. Babies, no matter how they're born, experience birth trauma and tightness. And like any doctor or pediatrician can probably tell you this, that like babies are tight after they're born. And if you don't have a professional who knows how to help release that in them, you're going to probably have issues with breastfeeding. And so, yes, going to the chiropractor, doing myofascial therapy, those were game changers for sure for both of my children, actually, with their breastfeeding experiences. And using the Thompson Method and doing the breastfeeding rescue calls helped resolve 95% of my nipple pain. And they also helped me work through how to help reduce my oversupply and my overactive letdown, which was causing a lot of reflux for both of my babies. So they have techniques that really, really helped. One of the things that they had me immediately stop doing was using the haka for suctioning on the opposite breast and getting extra milk out, because they're basically like saying you're training your breasts to think that they need to produce more milk than they do. So anything that's causing negative pressure on your opposite side, we want to do away with that. And in fact, even the ladybug style of the haka, which doesn't create negative pressure, it's just collecting extra letdown, is still encouraging your breasts to have extra letdown. And so one of the tips that I received was you actually want to try and teach your breasts not to release extra milk when the other side is being fed off of. So what I would do is I would take my palm, and when my baby was nursing, let's say on the left side, and I would feel the letdown happen, if I didn't do anything, I would soak through on the right side because of the letdown. But what I would do instead is I would take my palm, and when I would feel the letdown coming, I would press into my opposite breast while the baby is feeding on this side, because I'm doing them in the regular cradle, so my right hand should be available. Feeding a baby in regular cradle position. I'm using my fine tuning from the Thompson Method to make sure they're fully aligned. They're nursing, letdown comes, I press my palm into the opposite breast, and nothing leaks or comes out, and it teaches my breast, hey, we actually don't need to release anything extra. Baby is getting everything they need from that side, and then when they're ready to switch to the other side, whatever is left over here will be the right amount for them to finish their feed. This is really helpful if you have overactive letdown or oversupply. I would say if you struggle with undersupply, you don't want to try this. But if you're dealing with that issue like I did, that is so helpful. Just take your palm, gently press into your breast when the letdown happens. It will train your breast not to release extra milk during that time. So, I believe that I don't know exactly. I think the reason I was dealing with oversupply is because with both my babies for the first couple weeks, I was still allowing that letdown to happen on the opposite side. Plus, I was staying very, very on top of hydration and nourishing meals. And those are things that really help with your postpartum milk supply, especially at the beginning when your milk supply is regulating and your breasts are trying to figure out how much to create. If you're working really, really hard on nutrition and hydration, that is the number one factor that improves your amount of milk. And I didn't really struggle to eat, and I didn't really struggle with hydration, so I had plenty of milk. Now, on the flip side, if you are struggling with undersupply, there's really 3 factors that we hear of most commonly impacting that. One is going to be not enough food postpartum. And again, it's not just any food. You want nutrient-dense whole foods, protein, warm soups, stews, things that are going to promote healing in the uterus and milk production. So super cold foods or fried foods, really crunchy foods, that's generally not what you want to be focusing on initially postpartum, because those things are not going to stimulate the healing of your uterus or your C-section if that's what you had, and they're not going to really help with milk production. So high amounts of protein, fat, and fiber is what you want to be focusing on, and things that are warm, bone broth, stews, porridges, and things like that. And then hydration. So filtered water with minerals, because if you're drinking unfiltered tap water, you're getting all kinds of nasty toxins in your water. And then if you're not adding minerals back in, your body's not getting the electrolytes it really needs to nourish and hydrate your body at the cellular level. And you have to be well hydrated in order to have successful breastfeeding. We just know this is true. So if you're struggling to drink enough fluids, enough electrolytes, and you're struggling to come up with enough nutrient-dense meals, that may be why you're struggling with not producing enough milk for your baby. The third factor is nervous system. So if you're highly stressed, if you're dealing with a ton of anxiety around postpartum, maybe you had a really traumatic birth experience, or you're experiencing the loss of a loved one in your postpartum season, or maybe you're just really nutrient depleted and that's causing some postpartum depression, that nervous system depletion can result in the body not producing enough breast milk. So, making sure you're eating and drinking plenty of nutrient-dense, electrolyte-dense foods and drinks, and then also trying to reduce your stress. A lot of moms are so depleted after giving birth and don't realize it. And so this is where Postpartum Care USA comes into play. They are the only postpartum exclusive care clinic for moms in the United States. And what they will do is they will take labs for you that no other OB or postpartum provider, which there's really not postpartum providers, but they're going to take blood work for you to look at so many things beyond just a regular CBC. They're going to be looking at thyroid. They're going to be looking at your cortisol. They're going to be looking at your A1C, so your blood sugar, and they're going to be able to look at that full picture and say, hey, mama, you are super depleted in this area, which is probably why you're struggling with undersupply. let's work on this part of your diet. Let's work on this part of your hydration. Let's work on this level of stress. Let's try to reduce your blue light exposure. And then let's put you on this supplement lineup and watch your milk supply soar. And I have heard so many success stories of moms. In fact, I think that Postpartum Care USA has a 100% success rate of moms feeling better after receiving care from the clinic. And they're virtual, so you can do an online consultation with them. If you mention OrganiMama on your intake form, I believe you can get your intake call for free. So do an intake call with Postpartum Care USA if you're really struggling with your supply and you're not sure why you're not feeling like yourself. Instead of just giving up on breastfeeding, just give your body what it needs. Test, don't guess on what your body is lacking. And I can almost guarantee you that there's going to be pieces of your health that are missing that you may just not have picked up on. Because mama, if you're postpartum and you have a new baby and you're trying to figure out what life is like and breastfeeding and healing, that's a lot on your mind. So let the experts take a look at your labs and figure out what else you need rather than trying to scramble and figure it out for yourself or get discouraged and turn to formula when you actually were hoping to have a successful breastfeeding journey. So, after those first few weeks, first few months, then things start to change, right? Around 6 to 8 weeks, maybe a little longer, depending on your body, your milk supply will regulate to what your baby needs. And another really interesting thing about the Thompson Method is they actually discourage feeding every 2 hours. They say the average number of feeds in a 24-hour period should be about 7, which if you calculate that out, that is about 3 hours and 20 minutes between every nursing session. Now, a lot of moms are probably hearing that saying like, what? My baby nurses like every hour. And they have a really interesting explanation for this, but she has, again, she's done a lot of research on what is best for baby's gut and development. How frequently should a baby be nursing? And she really does stand behind this idea that on average, your baby should be nursing only 7 times a day. It might be 7, it might be 6 one day, it might be 9 the other day, but feeding 12, 14, 16 times a day is just not ideal for your baby's digestive system. And if you have a really colicky baby who's crying a lot or having a ton of reflux, if you're feeding them that often, that might be part of the problem. So again, I promise you this isn't sponsored. I truly just love them. Go take the Thompson Method, maybe do one of their breastfeeding rescue calls and see if they can't completely change the way you actually think about and go about your breastfeeding schedule and the way you do the actual act of breastfeeding and how you hold your baby and how you latch them and all of that stuff. So once I did the Thompson Method, things got so much easier for me and so much better. And I've never had to introduce any formula because I focused so much on reducing stress postpartum and making sure that my diet was really solid and my fluids were just continuous with good electrolytes. And I fortunately got to a point with both kids where nursing no longer was painful and things got much better. If you follow me for any amount of time, you probably know that we have chosen to do safe bed sharing, co-sleeping with our babies. So from the time they're born until they're about 1.5, they sleep in our bed with us. And we have another episode on this season talking about co-sleeping and bed sharing. So make sure you go listen to that episode. But, yeah, we obviously take a lot of measures to make sure our kids are completely safe in our bed. But one of the best pieces about that is breastfeeding is so much easier at night with bed sharing because I don't have to get out of bed, go get them out of their bed, sit up and turn on a light to nurse, try to stay awake, and then get them back to sleep. None of that. If my babies wake up hungry in the middle of the night, they are laying right next to me and I'm in the cuddle curl and I just simply lift up my shirt, give them access from side lying. They nurse right there. I usually fall back asleep while they're nursing and then they unlatch when they're done. And then we both go back to sleep. And actually, no, I do not burp my babies. I don't really think it's necessary. And the Thompson Method has some interesting thoughts on this as well. So no, I've never really burped my babies much at all. And I don't find a need to burp them for side-lying nursing either. And I get way more sleep doing things this way. And it's great. I love it. I would never do it differently because I love it so much. And I feel so much more rested breastfeeding this way at night with babies. So let's fast forward a little bit. I breastfeed my kids all through the night, all through the day, usually about 7 times a day up until they are 1 at a minimum. And I do get questions from people who are asking about like, well, I really don't like night weaning my 9-month-old, or I don't really like night nursing my 9-month-old. I just want to be able to sleep. My pediatrician says that they should be able to sleep through the night without nursing at this point, but they still wake up every 3 hours to nurse. And what do I do? And here's what I would say. I would say that if your pediatrician is telling you that from like a weight gain standpoint or age standpoint that your baby doesn't need to nurse through the night, that's one thing. But developmentally, breastfeeding is so much more than just calories for babies. It is comfort, it is nurture, it is development. And to try and cut off your child from nursing at night anytime before they are 12 months old, I would say is harmful. I would not ever try to change anything about my breastfeeding schedule until my kids were at least 12 months old, because that first year of life, there's so much development that's happening and so much nurturing that's happening and connection between mama and baby, that to try and forcibly wean them from night nursing before they turn 1, I think would be cruel. So I would not do that personally. I would not try to change or interrupt the way that they prefer to breastfeed or connect with you before their first birthday. So now you get to the first birthday, then what? Because a lot of moms are starting to feel they're tired of it. They're like, I enjoy breastfeeding, but it takes a lot of energy. It takes a lot of time. It's true. Breastfeeding takes a lot of energy and a lot of time for mothers. And sometimes you get to that point and you're like, I would love to just have my body fully back to myself. And I would say, after a year, it's really up to your discretion. Obviously, the AAP says it's beneficial for babies to nurse a minimum of 2 years. Now, I will say I have not nursed either of my babies to 2 years, even though, ideologically, I would love to nurse them that long. I've gotten pregnant before I've reached that 2-year mark for both of my babies. And so I have a really hard time with not tandem nursing, but I have a really hard time with being pregnant and nursing, especially since I get a nursing aversion during the first trimester. Like my skin gets all clammy and I get sweaty and I feel like I'm going to throw up when my kids latch for breastfeeding if I'm pregnant. So with my daughter, when I was nursing my daughter, my oldest, I found out I was pregnant and I kept nursing her, but it started to get very painful and I started to have this very strong nursing aversion. And so when I was close to the end of my first trimester, I had just kind of like gritted through of the nursing. And I finally decided when she was 18 months, I was about 3 months pregnant, I decided to wean her. So I did. And then with my son, I found out I was pregnant when he was 16 months and I weaned him the week I found out I was pregnant, because I was like, I just don't want to suffer through the first trimester with really uncomfortable and like nauseating nursing, because it's just too hard on my body. There are some women who I think feel fine to nurse through pregnancy and even tandem feed with a newborn and a toddler. I'm not one of those people. So I weaned both of my children while early pregnant. But a lot of the questions I get on Instagram are, well, how did you wean? How did you do it? I really want to wean, but I have like a boob-obsessed baby or a boob-obsessed toddler. How'd you do it? So here's kind of all my best tips for weaning. The first thing is that you don't want to rush it because it takes time. When I started weaning my kids, it was several months prior to fully weaning them. So I usually am thinking long game here of like, I want to be done breastfeeding sometime in the next 6 months. If you were to say, I want to be done breastfeeding next week, yeah, you're going to be frustrated because it's hard to just go cold turkey from like feeding multiple times a day to nothing. So usually I'm thinking about 6 months in advance. And then I'm going to slowly start dropping feeds just one at a time and offering a lot of water as a substitute. And another question we get is, well, do you transition your kids to cow's milk when you're weaning them and give them bottles? No, I do not. We do not give cow's milk straight up to our kids because it's not necessary. Cow's milk does not contain, even raw milk does not contain anywhere near the amount of nutrients for human babies that human breast milk contains. And if they're eating by the age of 12 months, if they're eating a nutrient-dense diet and not a bunch of processed crap, they're getting probably everything they need from their food. So we feed our kids. We follow solid starts for baby-led weaning for starting solids around 6 or 7 months old. And we feed them consistently solids like shredded meats and egg yolks and bone broth and vegetables and fruits from about 6, 7 months onwards. So they're eating a pretty nutrient-dense diet from a young age of, 6 months or so. And by the time our kids are 12 months, they're eating, 3 meals a day. They're drinking lots of water from non-toxic cups with straws. And so they already know how to drink water. They already know how to eat food. So I'm not really concerned about them not getting enough calories at that point. So I know that nursing is more for connection and comfort and sure, some calories, but they're getting the majority of their calories from food at that point. So yes, I'll start dropping 1 feed at a time. So maybe it's like the middle of the day feed that I'll drop first, and we just start giving them a bigger lunch with plenty of water. And if they ask for milk, I'll just redirect them to water, and I'll say, hey, Milky's all done right now. Here's some food. Here's a snack. Or I'll distract them with a song or a story and just kind of distract until they've forgotten. I use this method for daytime weaning to get down to 1 morning feeding when they wake up and then 1 evening feeding right before bed, where I'm nursing them to sleep usually. And then when they wake up in the morning, I'm usually nursing them once as well. But nighttime nursing is kind of a different story, because if you have a kid who's used to nursing multiple times during the night, it can be tricky to figure out how to change that pattern. So again, I would not try to change anything until after a baby is 12 months old. And then what I would do is I would have this gradual process. So let's say that you're in the habit of, like me, maybe you're bedsharing, and when your child wakes up or seems to squirm, you give them access to your breast, you let them latch, you let them nurse for as long as they want. You're sleeping during it maybe. And then when they're done and comforted and full enough, they're going to unlatch and be sleeping again. So what I would do for starters is anytime the baby is latching, and I would do this for about a week, anytime baby is waking up and latching, I would actually just set a timer. So instead of letting them stay latched on for 20 minutes or however long they want, I would set a timer for 10 minutes. And then when 10 minutes is up, and yes, this does require you to be a little bit more awake and cognizant during the night, but this is kind of what you have to do in order to slowly wean them off. So I set a timer, maybe on my phone or a little analog clock next to my bed for 10 minutes. When the timer goes off, I'm going to unlatch baby, and they might be upset. They might cry, but I'm going to hold them. I'm going to pat them, rub their back, say, it's okay. I got you, baby. Give them kisses and snuggles, make them feel so comforted and loved, and kind of get them into this rhythm of recognizing okay, I'm going to have a cutoff point of a certain amount of time. And once this time is up, mommy's going to, take me off. And then I'm going to slowly start decreasing that. So I'm going to go from 10 minutes to 5 minutes and 5 minutes to 2 minutes. And then I'm actually going to get to a point where baby's latching, and I'm not even going to really let them get to a letdown. So I'm going to let them latch and suckle for maybe 15 or 20 seconds, and then I'm going to pull them off. And again, they might cry, they might be upset, but I'm going to still just love on them. I'm going to give them kisses. I'm going to sing to them, rub their back, and they start to get used to this eventually. And someone might say, well, this sounds really cruel. It sounds kind of like you're doing the cry it out method of sleep training. And I would say, absolutely, this is completely different, because you're literally holding your baby and comforting them at the same time. So this is very different than that. They know that you're there with them, even if they're saying, I want to nurse. You're saying, no, baby, I still love you, but we're not going to continue that.
Have you ever picked up a makeup product, flipped it over, and thought, why does this ingredient list look like a chemistry final? Because same. I used to spend hours online trying to figure out if a product was actually non-toxic or just greenwashed with pretty packaging, and it was exhausting. So I actually did the work for you. After 5 years of deep research, I created OrganiBeauty, which is a guide that breaks down over 80 toxic ingredients to avoid, 5 that you should always recognize, and nearly 200 safer product recommendations for women, men, and kids. kids. If you want to clean up your personal care routine without losing your mind, check the show notes and grab OrganiBeauty. Podcast listeners can get 20% off with code podcast.
And so the other thing that I always find to be really helpful for this nighttime weaning is to keep a water bottle for the baby on my bedside table. So eventually I'll get to a point where if I'm unlatching them from their initial suckling and they're upset, they seem maybe thirsty, I'll offer them water. And I actually got to a point where I'm offering water every time they wake up. And for both of my kids, it has actually worked really smoothly, where they wake up, they start crying, and instead of like even pulling my shirt up, I just kind of cradle them in my arm, put the water bottle up to their mouth, they drink some water, they settle right back down and go right back to sleep. Yes, this is a process, and yes, it can take time, but this is really what I have found to work the best, and it's worked pretty much the exact same for both of my kids. The water bottle is so helpful, so helpful. Yeah, like truly. The best hack ever, I think, is to keep some filtered water in their cup on your bedside table. And instead of offering a nursing session, offer water and get them used to it, where they know, like, if I wake up and I'm thirsty, I'm not going to get to nurse, but I am going to get some water. And eventually I've gotten my kids down to where they aren't nursing at all during the night. They're getting a sip of water. And then when they wake up for the morning, I'll let them nurse. And then eventually, I just start doing kind of the same thing, where I just cut out that nighttime feed. I cut out that morning nursing session and I offer water instead, plenty of snuggles. I still rock my kids to sleep. My husband lays with our 3-year-old at night to go to sleep, which takes about 20 minutes. And then I am still rocking our 1.5-year-old to sleep every single night. So we're not they're not like crib or bed trained in the sense that we like put them in their bed awake and then they fall asleep on their own. We don't expect that of them because that's not developmentally appropriate. And we're still snuggling them to sleep, loving them to sleep. And then, to a certain extent, they will end up in our bed during the night. So that's really how I go about weaning. And the other thing that you may experience with weaning, and actually this is common during the beginning stages of breastfeeding as well, is engorgement. And engorgement, if you don't know, can lead to mastitis, which is an infection inside your mammary glands. And it is very, very, very painful, and it can cause high fever and flu-like symptoms. And it's not something that you want to deal with. So one of the hacks that I learned actually from an account on Instagram, you can look her up. It's Aloha Nutrition. Pinned at the top of her page is this post about something called breast gymnastics. And this is a really, really amazing technique that you can perform on yourself that helps reduce issues from engorgement and mastitis. And it can actually prevent mastitis from forming. So you basically take your hands, you're going to grab your breast, and you're literally going to do quote unquote gymnastics with it. You're going to stretch it in all directions up and to each side. And what this helps to do is elongate these milk glands inside your breast tissue and helps to stretch them out and prevent milk from getting too stuck inside any of them and clogging and forming an infection. And so breast gymnastics is something I do all throughout my nursing experience from day one of having a baby until I'm weaning them. Breast gymnastics really, really helps to keep your milk fluid instead of getting clumpy and infection-y. So if you want to watch like an even better demonstration, go check it out on Aloha Nutrition's page. We will link it in the show notes below. But that has literally saved me so many times, and I have never had mastitis during either of my breastfeeding journeys because of a variety of reasons, but one of them being just the frequency with which I have done breast gymnastics. It's kind of amazing. Okay, now we are going to take a look at some listener submitted questions regarding breastfeeding. One of the first questions was, could weaning in your first trimester of pregnancy lead to miscarriage because of the hormone shifts? I can't say anything definitively, but this is such a common experience of mothers to be weaning during the first trimester that I don't think I've ever heard of a link between weaning in the first trimester and miscarriage. I've never seen peer-reviewed articles that have found a link between these two things. Now, obviously, we are all bio-individual, and I can't say anything definitively for an individual person, but I don't think you need to be afraid of weaning because of fear of miscarriage. It's a pretty natural, normal thing that your body should be able to understand is happening while you're pregnant. Okay, the next question is how to stop my baby from biting once they have teeth. Mine laughs at me when I yell ow or no. I'm so sorry. That's really frustrating, especially when you feel like you're being gaslit by your baby. So I had this issue with both kids where when they were starting to get teeth in around 8 or 9 months, they would just take a little chomp of me to kind of test out their teeth and test their limits a little bit. So instead of just saying ow or saying no, I actually would unlatch them immediately and just kind of be like, you're done. If you're going to bite me, you're done. And I would wait, a couple minutes before I would let them try again. And obviously they would get upset. They would cry, they would scream, they would thrash around and be super upset because I cut them off from their meal. But I wanted to make it really clear, gently, but I wanted to make it really clear to them of you do this to me and the result is not good for you. And so quickly both of them learned hey, biting is not something I want to do to mom because when I bite her, I don't get what I want, which is to nurse longer. So I just unlatched them and that seemed to work really, really well for both my babies when they were in that biting stage. Okay, next question was how to get over the mom guilt when you need to wean sooner than you planned. Honestly, I can understand this. I really hoped with both of my kids that I could breastfeed them until they were 2 and ended up weaning both of them during my next pregnancies because I just couldn't take nursing while pregnant. And it was really hard. I think I had to work through a lot of emotions of feeling like I was a failure, even though breastfeeding to 16 or 18 months is a huge feat. I think just because even I would get the kind of AAP part of it stuck in my head of the AAP says it's ideal to nurse your baby until they're 2. So am I doing them a disservice by weaning them now? And, I don't really have a perfect answer for you, but for me, I know that I took it to the Lord in prayer and just said, hey, Lord, would you please help encourage me that it's incredible that I've been able to breastfeed this long? And would you please help take away any guilt that I'm experiencing about weaning them sooner than I would prefer? And just help me to know that my worth as a mother comes from you and not from anything I do or don't do for my children. Okay, there's a question that says when to use a bottle versus breastfeeding during the day and night. I would say this really depends on your lifestyle. If you are a working mom who is going to have to go back to work and you will be pumping at work, I think it's important that you do introduce a bottle to your baby between 4 and 8 weeks because you don't want to interfere with the breastfeeding experience for the first month. You want them to get really established with that for the first 4 months. But then it really is important that if you are going to need them to take a bottle in order to be able to go back to work, that you can get them comfortable with doing that on a regular basis between 4 and 8 weeks old. Now, I learned a lot of this as well from the Thompson Method on what shape of nipple to use and what kind of bottles are best. But one of the best tips I have for introducing a bottle between that 4 and 8 week period is for the mom not to do it. So I actually have never bottle fed either of my children myself. It was either my mom or my husband that was offering them a bottle. And so for my daughter, I was a wedding photographer at that season of my life. And so I knew that when she was about 4 or 5 months old, I was going to go back to working some weekends for photographing weddings. And I would need her to be able to take a bottle throughout for a 10-hour stretch of time from either my mom or my husband while I was at work pumping. And so what we actually did is around 6 weeks, we introduced her to a bottle from my husband, and he gave her 1 bottle every single day while I would pump in another room. And so she quickly learned that when dad was feeding her, it was from a bottle, and when mom was feeding her, it was from the breast, because I think that it would have been very confusing if I ever tried to give her a bottle. So I think my best advice for introducing a bottle is make sure it's not you that's giving the bottle. Make sure it's whoever is going to be taking care of your child when you're away from them. Now, if you're not planning to work or leave your child for any reason, then there's really no reason to teach them how to take a bottle. I think that culture wants us to feel like we need to get space from our children, and that it's healthy to get away from them. And I would honestly push back on that and say that it's not healthy for them to be away from us if it's not necessary. And so with my son, I was not working as a wedding photographer anymore, so I didn't need him to take a bottle. So we never gave him a bottle, never introduced it at all. I just breastfed him exclusively. And anytime I would go anywhere, he would come with me. He came with me literally everywhere I went, and I would just nurse him when he needed to nurse. And because we were bed sharing and doing contact napping, he would sleep great, like in a baby carrier wherever we went, because we didn't crib train, we didn't sleep train. So he didn't need to be in a dark, quiet room with a sound machine on to sleep. He would sleep on me. He would sleep in the carrier. He would sleep in the car. So I was never apart from him at all, until he turned 1, really. He came everywhere with me. I have never slept a night away from him. And right now he's almost 18 months. So normalize that, I think, because I think a lot of times, again, culture wants us to feel like, oh, you need to be able to have a night away from your baby and stuff. And I would personally say babies do not need to be away from their parents until they're at least 1.5, like overnight. And for me, working with my daughter, doing wedding photography was like a necessary evil because I didn't want to be away from her. And if I could have altered that, I would not have been away from her, but I had to work because that was like a big part of our income. And obviously not everyone has the ability to just not work. But if it is possible for you to keep your breastfed baby with you at all times and not ever introduce a bottle to them, there's nothing wrong with that. And it also, pumping is stressful. If you're like a full-time pumping mom or even a part-time pumping mom or a working mom who's pumping, pumping sucks. It really sucks. And pumping is just awful. So also kind of a necessary evil. So if there's not a reason for you to need to pump and give your baby a bottle, then don't, because you just don't need to if you don't need to. Okay, next question is thoughts on wireless breast pumps. Since we were just talking about pumps, this is great. I am not the biggest fan of wireless breast pumps. First of all, wireless breast pumps tend to not be as effective as removing milk as other types of pumps. And then the second factor is a lot of wireless breast pumps connect to an app via Bluetooth. So that's a lot of EMF exposure that you're having on your chest, very close to your womb and close to your heart. And close to your armpits. So personally, I like the Zomi Fit wireless pump because it does not connect to an app. It does not have wireless EMF coming from it. But also I would say in general, the wireless pumps are just not as effective and they're not meant for daily use. The best, most effective type of breast pump isn't even going to be one of those wired Spectras or anything. It's actually going to just be a handheld pump. So I really like the Medela handheld pump, or the Lancino one is also really great. You can actually swap out the bottles for glass if you don't want the milk collecting in plastic at the bottom. But yeah, I have had way more success when I have needed to pump with using a handheld breast pump where you're doing the pumping action yourself. And you can also learn how to manually pump your breast, manually express your breast. And that was another thing that I learned from the Thompson Method. Again, another shameless plug for the Thompson Method is that they teach you how to manually express your breast so that you actually could empty your breast if you needed to without having a pump on hand. And I sometimes used their manual expression techniques when I had oversupply, just a little bit to kind of relieve the very edge of the pressure with engorgement. But again, there's a lot more detail that goes into that. And I really recommend that you just take the Thompson Method course rather than just trying to pull bits and pieces from what I'm saying here and apply it, because there's just a lot more that goes into it than what I'm saying here. Next question is how to handle a baby that can't latch because of a tongue tie. Well, I did mention this some earlier with my own experience with breastfeeding, but I would highly recommend that you book a breastfeeding rescue call with the Thompson Method consultants, because they'll be able to watch you nurse and give you suggestions on your positioning to help baby with latching. And then if they think that you might need a further consultation, with a like a pediatric dentist who might be able to evaluate for tongue ties, or if they think your baby needs body work like myofascial or chiropractic, they're going to recommend that as well. But I wouldn't necessarily jump right to a tongue tie revision because there may be other things that you can do to gently help soften and loosen up baby's body before you go to a surgical intervention. Because the other thing about tongue ties that's tough is you want to be doing body work on your child prior to a tongue tie release, and you also have a lot of body work that you want to be doing on them after. So it's a big commitment, and if you have a practitioner who's just saying, hey, let's just take your child in for a tongue tie revision today, that's a red flag, because if they're not suggesting body work ahead of time, then you might actually end up having a procedure done that isn't going to make much of a difference in the long run, or could actually make things worse for your child. So body work before and after is super important. And if your practitioner is not suggesting body work before a revision, then you might want to get a second opinion for sure. But yeah, I would really recommend working with the Thompson Method people first before you jump to wanting to have a tongue tie revision done. Okay, last question I'm going to answer on this episode is any tips for twin mamas? I know I'm going to sound a little bit like a broken record here, but do the Thompson Method. They have a whole segment on twin mamas and how to be successful with breastfeeding for twins. And actually another account that I mentioned earlier was Aloha Nutrition. She talks about the breast gymnastics. She breastfed twins successfully for a super long time and has a lot of information on her page about breastfeeding twins. So that would be another great place to look. And she has a lot of great information about how she set things up for breastfeeding and bed sharing. She did bed sharing with her twins as infants. So she has a lot of great info on her page that she's saved to her highlights on breastfeeding twins and bed sharing safely and all that stuff. And she's a lactation consultant too. So a great place to look for information on that. Okay, guys, we are wrapping up for today on this topic of breastfeeding and weaning. I hope this was helpful for you. Bottom line is go take the Thompson Method breastfeeding course if you have not yet. It is life-changing, and I learned so much from them, and I highly recommend it for any mom who is pregnant or wanting to be pregnant in the future, or currently nursing and struggling with breastfeeding issues. The Thompson Method truly is incredible. And no, they are not paying me for this endorsement. They don't actually even have an affiliate program. So I'm just saying this because it truly worked wonders for me, and I believe in what they're doing, and I believe in their approach. So that is all for today. I am so glad that you joined me for this episode. I hope it was helpful for you, and we will catch you next time on the OrganiMama Podcast.
Nobody warned you that preparing for a baby would feel like prepping for a small, very cute science experiment. Like, is this baby item safe? Why does everything smell like plastic? And how did you just spend 45 minutes reading reviews for a diaper trash can? Enter the OrganiBaby Guide. It's your shortcut to toxin-free baby prep without losing your mind. It tells you exactly what to put on your baby registry and what's actually worth it, and what you can skip, calmly, clearly, and without the fear-mongering. If you want fewer tabs open and more confidence in what you're buying, head to the show notes, click the link, and grab OrganiBaby. Podcast listeners can get 20% off with code PODCAST.